morning, everybody, and welcome to the National Association of Latino Healthcare Executives conversations with top Latino healthcare executives. My name is Tom Shorter. I am a partner in the law firm of Husch Blackwell. Husch Blackwell is extremely proud to be able to be a sponsor and supporter of NALHE in its work across the United States in supporting Latino healthcare executives and education. And I've had the great pleasure to get to know our presenters for today, and I have the honor and opportunity to serve on the NALHE National Board of Directors as well. So today we are going to have a free-flowing conversation with two of our top Latino healthcare executives, and we're going to cover a lot of topics, but we are hopeful that for those of you who are able to dial in or listen in, you'll be able to use the Q&A chat box to pose questions. Tell us some of the issues that you'd love to hear from these two amazing individuals on the experiences over the last couple of years. And as much as I keep wanting to say we've come to the end of this 2-year pandemic, and I really, really want to say that, I know we're not quite there, but we're maybe getting there, and you know, there's been a lot of lessons learned, and I think there's a lot of things to plan for, some challenges, how we're dealing with staffing issues and our greater communities, and we're gonna talk about those today. So to start out, what I'd like to do is ask each of our participants today to give a brief background, so all of the folks that are dialing in today know really the position that you're in, and the system that you work with, and then we'll dive into some of the discussion topics. So, Monica, why don't you go ahead and go first and give everybody a greeting and let them know your background.
Well, good morning, and it is a pleasure to be with you this morning to be a part of this conversation. So thank you for the invitation. And certainly thank you, Tom, and to Husch Blackwell for your support in sponsoring of the National Association of Latino Healthcare Executives. So as Tom mentioned, I am Monica Vargas Mahar. I have the pleasure of serving as the Market Chief Executive Officer for the Carondelet Health Network located in Tucson, Arizona. I'm new to the organization, and I've been here almost a year, not quite yet at my anniversary mark, but previously served as a Chief Executive Officer with a hospital system in El Paso, Texas. So I'll be bringing to this conversation today a bit of my past experiences, both in my time in El Paso as well as in Tucson. In addition to those responsibilities that I have now that keep me busy at work, I'm also very proud to serve as the president and board chair of the NALHE organization, an organization that is very close to my heart. And I really thank all of you who are dialed in today to hear and be a part of this conversation. And I do hope, as you said, Tom, that this becomes an interactive dialogue with those that we're going to be, who are joining us today. So thank you.
Fantastic. Thank you very much for that, Monica. And as you've heard me say before, thank you for all of your service to the board and to NALHE. It's a great asset, and it's amazing, particularly when people know how much of your day-to-day job you're busy. So you do this too, which is absolutely amazing. So Xavier, why don't you give us a little bit of your background as well?
Thank you, Tom, and I would echo that. Monica does an excellent job of leading our organization. It's great to have her on board. It's great to have you as a partner as well. It's been a big help. And so, and welcome to everyone out there today. We're excited to share some of our insights today. My name is Xavier. I've been the CEO here at Hillcrest Medical Center in Tulsa, Oklahoma for the last 3 years. I just celebrated my 3rd year anniversary last week. So really excited to be back where I actually started my career. So I've been in healthcare for over 25 years and got an opportunity to start my career here at Hillcrest and here in Tulsa. I've spent the remainder of my career in between the beginning and now really around the North Texas area. And so spent a number of years around the DFW area, but was really excited to get back here. And I remember my 1st year anniversary was right at the beginning of this pandemic. So I know Monica's has some strong experiences getting kind of started in that first year period. I think that was pretty eye-opening for me to jump in after year one, right into the middle of this pandemic, and really been kind of the focus for the last 2 years. But really glad to be here and share some of my insights. And again, thank you for your support, Tom.
Yeah, absolutely. Thank you for that, Xavier, and I appreciate that. And thank you also for everything you do for our organization at NALHE, and in addition to all the busy day job that you've got as well. So maybe just to kind of kick off the conversation, we wanted to sort of thematically talk about sort of learning from our past and then how we create opportunities going forward. Just thinking a little bit about obviously what we've all been living and from a pandemic experience and thinking about that from a leadership standpoint, maybe as an overarching item for us to talk a little bit about is some of the things that we learned at the front end of this about our hospital communities over the last couple of years, and maybe just start off with some comments on some of those things that were the first sort of learnings, right? I mean, when we first stepped into this, I think so many of us, myself included, as a lawyer trying to support healthcare systems, were sort of reeling, like, how do we start to even begin to assess what problem we have here and what's going on? And so maybe just some of those initial things that you were learning and thinking about as the pandemic was really not even defined as a pandemic yet, right? It was sort of a, undefined spread of an illness. So I'm curious if you just have some initial thoughts on that, in terms of sort of like some of the initial reactions and learnings that each of you had.
Yeah, I think one of the things I think that was challenging up front is it was pretty fearful. I mean, I was trying to figure out really what is my role in this. This is a national pandemic, worldwide pandemic, and what I quickly learned is a couple of things. I think the speed of getting information out, whether it be in our organization or across the country, and quite frankly, information we trust was so key early on in this process, and really being able to share as much information as possible and level set was something that was pretty key. I think the other thing that was insightful for me is that we've always had some, I would say, staff shortages over in healthcare for years. When you have a pandemic like this that impacts almost every hospital across the country, that really gets pointed out very quickly. I mean, it's one thing for parts of the country to have surges. You can kind of move staff around, but when the whole country is dealing with the surge, you realize how short we truly are in some critical staffing positions. I think that was very eye-opening and very scary for me early on. Still is very scary.
Mm-hmm. Yeah. I'll just add and chime in, and I agree with you, Xavier, that speed of information, the fact that you'd issue a communication piece to your staff in the morning, and by 4:00 in the afternoon, that guidance had changed, because that's how quickly information we were learning. I think for me, probably lessons learned is not only that fear, right? We all had that fear. Early in January, we thought, well, just as long as I hadn't been on a cruise ship, just as long as I hadn't been to visited these Asian countries, even our signage said, that was our screening criteria. It's, well, if you had been to these places, then, you might need to stay out. And quickly, you just felt the enormity of the situation sort of start to squeeze in on you. There was no safe place. So March 16th was when our community went down on lockdown. And so then you just felt it, because while, colleagues and others, even my own family got to shelter at home, we were still all going into the office, and it was an eerie feeling getting on the freeway when you were amongst 2 or 3 other people in rush hour. It just felt odd, right? I mean, those first days just was like, where am I going? And what am I going into? And as a leader, I think this really demonstrated for me is how we always have sources of support. Xavier and I have the benefit of having gone to the same graduate school. And I know Xavier, he's a colleague. I could call him. How have you dealt with the situation? There was no colleague to turn to at this moment. Everyone didn't have answers. And, it felt very, not only are you high in the organization where you are alone just by nature of your position, but there was no information that you could give your team to sort of rally the support. And so it did require a great deal of, looking in and sort of harnessing what we all know are the characteristics of leadership, is being brave and in uncertain situations and being able to be out there. And we'll talk a little bit about some of the strategies that we used. But to me, those were those moments where, quickly it went from, I was safe, I wasn't on a cruise ship, to, man, I was in a grocery store, and community transmission just soared in a matter of days and hours.
Yeah, absolutely. I think, thematically, one of the things that I think you've both mentioned that is worth, spending a little bit of time really from a leadership perspective to talk about is sort of the leadership in those moments of fear, right? Where there is a lot of unknown information and fear, panic. I don't know, pick your word, but it was running rampant for sure. And I think that's a real challenge at a leadership level, because, you're trying to lead everyone forward to continue to provide, obviously, care for the community. And Monica, you put it well. It's like, okay, well, 3 hours ago, this is what the state of the affairs was, but okay, well, that's all out. And so, some thoughts about how you deal with that from a leadership perspective, about letting staff know, yes, things are changing, but we're trying to address that particular issue the best that we can under the circumstances. And I know you both experienced that. I'd be curious if that's something that you were, having that additional conversation with your leadership team and staff to say, yes, it is changing, and don't let that further the panic, because otherwise we're going to be without any sort of calming of the waters and ability to serve the communities. I don't know, thoughts from either of you on that?
I'm going to take a first pass at it, because Xavier, I think you're going to approach it slightly different. Maybe I'm thinking to myself, now sitting in this chair, just not even at a year, I had an incredible advantage, because the organization I was a part of, I had been there well established 2.5 years. I already had sort of earned credibility. So it was much easier to go to individuals, ask for forgiveness. But I am curious, Xavier, because these challenges are not unique. While we hope never to be in a pandemic, we will be again faced with situations where we don't have all the information. And so I'm really anxious to hear, you're only a year into it. How did that differ?
Yeah, I think it was, when you think about it, and you've kind of gone through this, when you start a new role, particularly a leadership role, I mean, that first year is you're getting to know the organization. You're kind of putting your touch on things. You're introducing some of your focus of where you want to grow. So I really, myself and my team were in that kind of mode. I mean, we really felt like we were starting to make some headway with where we wanted to see the culture of the organization go, and that really does take a year, even more than a year, to do that. So this totally stopped that. I mean, it stopped us in our tracks, and we had to pivot. And that really is hard to do when you're plugging in pieces to your team and to the strategy for long-term growth, and all of a sudden it's like 100% of your attention has to switch to this. There were still some folks that, they were trying to, we had some openings in the position just because of some natural turnover and changes in leadership. We had some folks that still didn't, they knew me, but didn't 100%, know my background and trust me. And so I had to put myself in that role, after really now, hey, this is our entire focus is around this pandemic. You've got to kind of trust what we're doing, and we're going to do these steps to really over communicate. what that is. And quite frankly, it was trying to figure out what role do we play and how do we make that happen with some with some things that traditionally worked were not working. And so when we start thinking about town hall meetings, I mean, it was easy for me to put together a town hall meeting. I had 4 of them the first year I was here. We did it every quarter, got everyone in a room and talked, and all of a sudden that was gone. And you couldn't do that anymore. And that was an easy way to communicate to the whole hospital within a matter of 2 days. And so we were, the speed of information that Monica talked about was happening. And at the same time, we're trying to figure out how to get that word out in a way that reaches everyone and in a way that they trust us. And I think that was key. It involved a lot of, we did a lot of rounding here. We were out in front of the staff as much as possible, which, early on was was scary for me as a leader because, I had a family member at home that was going through treatments and they were at risk. They had a lowered immune system. So, in my mind, I'm thinking every time I walk out of my office, I'm potentially impacting my family. And every one of our leaders had stories like that. And so we were trying to be very, very creative in a situation where I was still fairly new and we were kind of heading in that direction. And the other hard part is every time we saw a lull in the COVID numbers, we almost tried to jump back into that where we were before, and it never really quite worked. And so that was another big challenge for us.
Yeah. It's interesting. It's great to hear that perspective. And I think Monica's right. It is a unique situation when you come in and you're newer in that organization from a leadership standpoint, because, one of the words, and you used it several times, was trust, right? So in the midst of a crisis, when you are in a leadership role, part of the ability to lead through that is based on trust. And, Monica, you had years of built up trust, right? You had the staff, and Xavier, you were building that, right? It was sort of as you were going, and that's a real challenge. I mean, that's a hard thing to do. And, I'm imagining that from how to do it in that period of crisis is lots of communication, lots of connection with people. And I can only imagine the sort of personal stress on that too, because, for myself, I basically hunkered down in my basement. I mean, Monica and I were just joking about this. She knows what the basement looks like for me when I would do video calls, because that's where I lived. And so it didn't create personal risk in the way that it would in a hospital setting, where you're still having to build that trust, get out, work with the leadership team and staff. And so that's yet one more reason you have all my respect. That's really incredible. Couple of things, and thank you, by the way, to everybody who is dialed in with us. I see we've got a couple of questions that have popped up, and so let's jump over to them really quick, and then we'll keep our free flow conversation. So this is actually a really interesting one. The first one is one that I think was very prevalent for all healthcare leaders, right? So we're in the middle of pandemic. Lots of communication out of CDC and other organizations around masking, community requirements around masking. And then we did see a lot of politicization of the masking issue. And the question goes to that very issue. And that is, how were you, or really were you able to avoid the politicization of masks in the facility and generally in your community? And so I'm curious to hear from both of you how you navigated or thread that needle, because I know that was not an easy one for sure.
I'll start by jumping in to share that, I was coming from El Paso, very fortunate. This was not an issue for us. We had good support and buy-in from both our team members, our physicians, and our visitors at the moment that there was or wasn't allowed visitors, because that's a whole nother topic. I think while not asked of the question, no different would be the conversation around vaccinations, because that became more contentious, I would say, this go around. But I think the reason why we were successful in avoiding any politicization as a word of masks or vaccination is El Paso, Texas, in November of 2020 was actually on the national stage. It was the epicenter of the crisis in the country, having more active cases than our other large cities in the state. You know, when you look at counties that represent Houston, Dallas, San Antonio, and Austin, that combined number of active cases was less than what was sitting in El Paso, Texas, a community of 800,000. And so it was very real. If my stat is not mistaken, El Paso was one of the first communities to achieve a high threshold in community vaccination rates because it touched so many. And I think people saw it, front and center. I think, and I certainly, Xavier may have a different perspective, but I think for us, that was the reason why it wasn't a political issue. It was, we saw what it could do. We will comply with the recommendations.
Yeah. I would say in Oklahoma, it's probably a little bit of a different, as you might imagine, kind of the Midwestern states. We did have a little bit of a different reaction here locally. There was a little bit more of a politicization here. And what I found was interesting, and if you don't know much about Oklahoma, there's two major metropolitan areas, Oklahoma City and Tulsa. When you get outside of those two metropolitan areas, the populations of the communities become very small, very rural. And so one of the things we saw is Tulsa, the city of Tulsa, had a great response to this and really encouraged through their health department, through the health leaders, really encouraged masking, vaccinations. And most people did really kind of adopt those rules. All the surrounding communities did not. And so we were receiving a lot of patients, transfers in from these rural hospitals, COVID positive patients. And, we tied it back to the fact that there was just not much of the support in some of these smaller communities for these types of measures. And so that was a little bit of a challenge. And one of the things two things we found that I think were insightful. First off, we found that people tended to trust their primary care physician. So we tried as much as possible to put physicians front and center that provided kind of plain story facts of what was working and not working. And it didn't always work, but a lot of times people look to that kind of physician or their personal physician even as that kind of person they trusted, back to that word of trust. The other thing we did, and it's become part of our workforce strategy going forward, is this kind of idea of this work environment and safety and security around what we do every single day. There was very few days of the week that we did not have someone at least get angry at our screeners that they had to mask. And so we had specific wording and scripting around that we trained them on. We had increased presence of security in the area. We taught our security how to manage through that situation to where it didn't escalate. And so we spent a lot of time really kind of talking about that piece of it, knowing that we knew it was the right thing to do. So we continued to set the example in the community of masking, but it was really spending some extra time on that script and how do you respond when you know some of these things are going to come up. So. Yeah.
Did either of you find that in as you in your outreach to your general communities about issues like masking, and then, Monica, your point about vaccinations, I think that's very true too, where you felt that there was a difference in the different contingencies within the community on how you'd communicate with them or connect with them? We're using different, spokespersons. I mean, just maybe reflect upon that a little bit on how you were sort of reaching out to the different contingencies within your communities.
I'll say, and I agree with what Xavier mentioned about the healthcare provider was really source of truth, source of information. And I think we leveraged, where possible, putting our physicians, offering themselves to city council representatives. The one way that we really connected with our community to help with this was being a community site to offer vaccinations. This, again, if you'll go back, this is at the beginning, January 2021, when in fact there was just such great demand for, grandparents to get vaccinated or, immunocompromised family members, and reintroduced ourselves as a place of where our community could come back to a hospital, not just in the moment of dealing with the COVID crisis, but for preventative care. And it was safe to walk into a hospital, and we had really good practices about how we were social distancing people. And, they got to see our teams in their, mask. So they just got to see how we as a community can really live in a very productive way, even taking the necessary precaution and measures. And I think that was helpful for our community.
Yeah, no, it's great.
Yeah, one of the things I would add on that I think was a very positive result of this is we very quickly opened up the lines of communications with our competitors, where we have historically not, had a kind of a consistent cadence of communication. And we got to a point where daily we were sharing information with our competitors about, what are we seeing in regards to numbers? How are we managing visitation policies? How are we managing masking messaging? And so we made sure that not only our system, but the rest of our competitors in town were all on the same page. So it seemed to our community like a very clean, consistent message. So we weren't saying one thing and our competitors were, not enforcing masking. It was very consistent across the board. And that, to me, was a really good result of this. Is we quickly realized, hey, we're all in this together, and we've got some best practices we can share. And we can still be competitors, but still make sure we're doing the right thing for our patients, so in communities. So I thought that was a neat result of this.
Yeah, no, it's a great point, and it's a community focused, aspect of that, right? It's really about how do we come together for the betterment for the general, entire community, even though technically you are competitors in that space. So it's a great point. I'm glad you raised that as well. One of the additional questions that popped in that I think ties well actually with this conversation too, which was how to avoid the political nature of the information that was coming out from the government, CDC, otherwise. As the question posed is written, it's what about the disinformation? And it's there was a lot of information coming out, and that really was an ongoing issue. And so with all of the speed of that disinformation, I think what the question is getting at, how did you deal with that? Because as much as you were probably getting questions about the information that was coming out, maybe from CDC or otherwise, there was a lot of disinformation coming out, which fed into fear and concerns. Thoughts on how you dealt as a healthcare leader in your community with that information, that disinformation?
Yeah, I think you're right, and that was one of the things that amazed me in this is how much disinformation was out there, and sometimes how much we as healthcare providers were questioned. And I would say a couple of things. I think we were very focused, of course, on the science, and I do think there were some missteps even nationally in regards to how the information came out and how the story came out. We tried to share as much of that information up front, and then really try to share our real life experience. So when it came to stuff like vaccinations, it was very easy for us to put out and say, here's how many patients in our hospital are inpatients that are not vaccinated. Like these are the clear numbers. We're not making this up. This is our experience. So you make your own conclusion from that. And so we were trying to very much share what our real experiences were, not necessarily what a national trend was, but here's what our hospital's going through. And then again, as much of the science and stuff that we could reiterate and communicate, I think was important. The other thing that I think was eye-opening for our doctors is when they hit that point, when I saw some interesting responses from our physicians when they started seeing pushback on, the science. They started seeing some of that disinformation. We had a couple of doctors that really kind of stepped up and said, hey, guys, we've got to approach this in a way that we stay calm and not overreact to negative information, that we really stay focused on what the right messaging is and know that our patients have a choice. At the end of the day, we're not going to force them to do anything. We've got to share the information as best as possible and let them make an educated decision about that. And we kind of stuck to that, and I think that did help from a disinformation standpoint.
I'll just add, Tom, to what Xavier is mentioning, and I think, the point made about really collaborating with competitors early. I think all of our communities did that. We had to.
Mhm.
I'll tell you, looking back, I think it was much easier to manage the disinformation issue at the beginning, because everyone was doing it the same. That's fine. You do have choice, but the truth is you weren't going to go out and find a place that was going to allow you to be at the bedside of a COVID positive patient. Like that just wasn't happening, right? Someone told me, nothing's going to happen to me. It's going to be fine. I'll tell you, I think for me personally, I think 2021 was much more difficult of a year to respond to the pandemic than 2020. I hate to say that, but in a way, I'd go back and do 2020 all over again versus 2021, because there was now a challenge by the community, right? The community was done, we had opened up, and you did have therapies being brought to I read that this therapy would be the one that I need to receive. Ivermectin is one that comes to mind. And our hospital community chose not to participate. But yet, there were providers in the community that were prescribing alternative therapies. And so you found yourself a little less firm that there was now all sorts of variation in the community. But again, you just have to, like Xavier said, when dealing with visitors, scripting of our security staff, now it required us to be scripted by our medical staff and our clinicians. And it became more difficult, right? Because in some instances, you weren't going to win, and that was okay because patients did have choice. And there were other alternatives for folks to go seek, those alternatives that were being offered with scientific data or not, right?
Right. Well, the concept of some of the, Xavier, that you brought up too, of collaboration, right? And you think about that collaboration in this disinformation phase. I can imagine how that is could be a powerful tool through collaboration, and I wonder if that falls in the camp for the two of you, as think about these lessons learned through the experience that people can carry forward. I wonder if that jumping quickly to collaboration with others that are in that industry is something you'd include on that list of, this is something to jump to pretty quickly in the event of something like this. I mean, is that sound fair from both of your perspectives, that's on that list?
Yeah, absolutely. I think I've continued the conversations about every 2 to 3 months. My counterparts at my two competitors, we sit down for lunch or drink, and we have some of those conversations. And I think one of the things, I've been able to see this as I go from hospital to hospital. I've gone from different hospitals in my career, is we're definitely more alike than we are different. I mean, the experiences that I'm experiencing, at Hillcrest are probably very similar to what Monica is experiencing, and so there's a lot of similarities, and the ability to sit down and kind of talk through those where it makes sense, and it's not, again, we still are competitors in some sense, but one of the things we're talking about right now is behavioral health, and partially as a result of the pandemic, but partially we've always had an issue with how do we get patients out of our EDs and into behavioral health services. All of our hospitals in this community have that problem, so why not sit down and work together to try to fix it, while still remaining competitive in nature. And so I think that's going to be something, at least for me, that's really important going forward.
Yeah, no, that's great. And it's, I certainly doing the work that I do around the country, I would tell you, I see more of that now. I see more of the recognition that, all the systems maybe in a certain community or a region dealing, with a similar community need, and the power that actually can happen when there is collaboration in trying to tackle that community need. You gave a great example, and it's one I'm seeing a lot, which is the sort of the mental health support needs that occur in communities. And it's a great space where all the systems are thinking about the same thing, and how they do it, and lots of really neat, actually, and innovative collaboration that's going on around the country in that particular space. I alluded to a little bit of discussion about staffing, and I want to come back to it. And I know, Xavier, you mentioned it as well. And we actually have a really interesting question that's a good sort of, segue of sorts to talk about staff and staffing related issues. And the question that was posed was, after receiving some candid feedback from staff, we are working to regain some connectivity and community with our teams in this new phase of the pandemic. We lost a lot of group activities and meetings out of an abundance of caution over the last 2 years, something I think a lot of people have experienced. What are you doing differently this year as a leader in an organization on this front? So again, I think the theme there is, a lot had to change. We did lose some of the meeting side. It started looking differently, and some things got lost out of that. And so thoughts from the two of you on what you're going to do differently as we're coming out of this pandemic period on that particular issue as a leader.
Yeah, I'll jump in and say that we're slowly trying to go back and reintroduce, Xavier at the top of this conversation talked about town halls. And so returning to bringing teams together, I think we have demonstrated that you can safely gather. Again, we still require masking in all large group settings, and where possible, we try to make our spaces large enough where you can safely, still gather and not feel like you're crowded in a space. But yeah, we've been through a lot as a team for 2 years. Here we were as a team of healthcare providers in the moment that we needed the most support from one another. What did we do? We put everyone behind a mask, told everyone you must be 6 feet apart, and you cannot even enjoy lunch with one another. You got to eat alone in a corner, right? And weren't there to support one another as everyone was experiencing these same fears and concerns together. So we're going back to bringing about our celebrations. And I think what we've demonstrated is you can still do all the things of before. You just have to consider the environment and the current situation that your community's in. So as we're looking forward to celebrating really the season of celebration, as I think of it, Nurses Week and Hospital Week, a lot more of our activities are looking at where we could leverage outdoor spaces and, food trucks in the parking lots and things where we can still come together and kind of take off the mask and see one another again for the first time. For me, for the first time meeting my team without the mask on. So.
Yeah, I would agree with Monica. I think that's one of the things where we realize quickly is the personal connections and touches and closeness is an important part of the work we do as human beings. And I think, across the country, people have seen that when you're missing that becomes a little bit of a challenge. And so, to Monica's point, how do we start introducing some of that in a safe environment? And we have done a lot of stuff outside. That's been helpful for us. We've also come up with some, as we've adapted to new ways of communicating, some of these have kind of taken hold. So for example, our town hall meetings, where we traditionally would have maybe a 20-30 minute presentation and then questions and answers, wasn't always feasible for everyone to get to. So we moved those. Instead of doing a kind of a slideshow presentation, we put them on some poster boards, and the exec team just is in the cafeteria every day, for a couple of days, and people can just come and go. And so it becomes a quick, hey, here's the key points we wanted you to know. What questions do you have? It's already in a space where people are kind of walking through anyway. And people have liked that. We've actually gotten pretty good attendance at those without people having to carve out, 30 or 40 minutes to sit down in a room and listen to a presentation. So we're keeping those. And so we're extending them to where instead of doing a couple hours, we'll block from 10 to 2 and try to cover the lunch hour. And so as we've identified new ways of delivering the message, those are things that I think are going to stick with us, that as we continue to kind of open back up, we'll be able to build on even more.
Yeah, no, those are great tips. It's, again, that opportunity to have direct communications and and be there present to address questions. That sort of, again, goes back to the theme I think I mentioned and you guys mentioned before of sort of creating that trust, right? I mean, that's really the way you do that. So that's great to hear. In terms of staffing and on that kind of theme, were there any other additional staffing support opportunities that your organizations implemented? Whether that's in a particular service line or area, were there some other things that you implemented during this period of time that you think, wow, this is something we're going to really carry forward and continue to do post pandemic?
Go ahead, Xavier.
No, I think one of the other things that really came up for us was the wellness piece and how, I think, vulnerable staff can be sometimes. And, part of that's the lockdown, part of that's just I describe this as, the uniqueness in healthcare is when you go home and you're listening to the news about a pandemic, you come to work and you're hearing the same thing. It's almost a 24-hour cycle of, you don't ever really get a break away from this. And so the wellness piece for us has been really key is how do we really get more proactive in ensuring our staff is in an environment that, is safe, but also really promotes that kind of mental well-being. And there's a lot of things that we've done. I think probably a lot of hospitals across the country have done in regards to some relaxation rooms. We've monitored PTO usage and really tried to look at, not necessarily force PTO usage, but giving the opportunity to have a conversation with staff members that haven't taken time away from work. How do you have that conversation with that individual to encourage them to maybe take a break if they need it? And so, being able to have some rotating leaders when we're doing stuff like being on call and being responsive to stuff, positions on the weekends, how do we rotate that so some of us can truly get a break away from everything? And so I think there's some of those things that we're really going to keep long-term and are very important for us.
Yeah.
I'll just add that while, one of the things when it came to staffing and being creative, I think what we identified is how individuals, when given a challenge, really can step up to the plate. And this was, if nothing else, 2020 and the pandemic really showed how healthcare can innovate, and it accelerated innovation in a way that our industry needed to see something happen, right? And we can talk through the technology aspects of it. But from a leadership and people side, I think one of the things that was really successful in the organization, and while we don't still use this strategy, I think it demonstrated the value is at the very height and moment when we were, again, the epicenter, we were having to transfer patients out all across the state, even across state lines for access and care and beds. That's how we were load balancing as a country. We staffed a command center 24 hours a day. And we actually brought leaders from non-clinical areas of the organization to be a part of that process. So, your director of revenue cycle, which sits in a finance function, was sitting in this command center, assisting with memorandums of transfer or bringing supplies and resources. And I think for me, when I think about staffing, is not to underestimate the skill set that any individual who's part of the team can offer in managing through a difficult situation. And again, we had the director of medical staff office, handling calls and sort of facilitating transfers and arranging for the helicopter to arrive. And at first there was a great deal of apprehension, like, oh my goodness, I'm not a clinician. How can I be in that space? Because our clinicians were up on the units doing clinical work. It required all of us. So I'd say that would be one of those things when you think about leadership and staffing is just, we have, there is a tremendous talent in our organizations. And traditionally we tend to stick in our lanes. And this definitely demonstrated this wasn't going to work long term.
Yeah, absolutely. No, those are great points from both of you. And I and on a personal level, I found that wellness aspect of it too was that came more to the forefront. It was more, I think, a part of some discussions because the the stress that was on, the staff in healthcare that we're providing for the communities became more visible. It was more, prominent. And so it's a great point, and I think it's a great, from a leadership perspective, reminder. And Monica, your point about the medical technology, I can't help but sort of jump on that one too. I mean, there's some amazing stuff. I mean, I think everybody knows, and I certainly see it from the vantage point I come at this, telehealth and the sort of adoption of telemedicine really, I think, will be one of those things that for sure will carry forward. And I assume that's consistent with what you guys saw at your two organizations as well.
Yeah, I'll just start by saying, yeah, absolutely. I think, as I mentioned, healthcare was in need of a push to innovation. I mean, we could say that we're an innovative company, but this sort of rattled us forward. And yes, we were using the technology as a healthcare provider providing inpatient care. Our use of telehealth actually was a bit more adaptive, really to create an opportunity so that we would minimize the risk and exposure of our team or our physicians from entering rooms that had COVID positive patients, to only go in when absolutely necessary. I'll tell you, our systems became much more sophisticated as we went on. But very early on, I'll tell you, one of the pieces of technology that we ran to was the baby monitor. And for folks who have new kids, the technology is pretty amazing. You set it in the room, you can actually see, talk, visualize the patient. And that allowed us to have a safe way of having, again, wasn't a tremendous IT solution. We just had to run off to a Best Buy, for instance. Now the technology, that was at the very, very beginning of the pandemic, but I think that's how we used the technology to really protect our patient, our team members, to say, when a patient asks, what time is it? You don't have to race into the room. There's ways of being able to communicate for smaller tasks, and then only jumping into the room and being a part of the care when you absolutely when it was that time to interact with our patients.
Yeah, I would agree, Tom. I think the telehealth solution, that's going to be a big part of healthcare going forward. I think one of the other things that has been eye-opening to me is some of the solutions, at least in my location, that we put into place historically. You kind of come in and you set up a model for what is best for multiple parts of the facility. So, for example, I always use the example of like Pyxis or these automated medication distribution centers. You kind of set those up, trying to make sure you're efficient and you don't spend too much money, but you don't ever set it up for the end user in mind. So, does anyone really stop and say, okay, from a nursing perspective, you're the ones using this system, let's go through and make sure we set it up exactly for what you need to make your life easier. And so as we roll out some of these, some of this new technology, we're really trying to be very thoughtful about sitting down and looking at who the end user is, and then deciding, okay, instead of only needing one Pyxis machine here, maybe we need two, because that helps reduce, 30 minutes of time off a nurse every day with the workload they're doing. And so whatever the technology is, we're really trying to focus in on what that end user needs, and building systems around that to reduce work, the amount of work or extra work that people have to do. I mean, because I think going forward, that whatever the new work model looks like, it's going to be, how do you reduce some of these extra steps and workload and take those off of some of the key people that you need at the bedside. And I think that's going to be important.
Yeah. Well, and there's nothing like a crisis of workload to push us, right? Both as an industry as a whole, to look for technological supports that make it easier, to your point, Xavier. So I think that's something that I'm sure will be carried forward by all the systems in the country. I'd like to hit on a couple of questions that I've seen come up from folks that are listening in, and I appreciate very much some of the questions. So one of them really starts to focus in on some discussions around the Latino Hispanic community, and in particular, one of the questions that's being posed is your thoughts collectively on why it seems that the Hispanic communities have been slow to get the vaccine and boosters, while they're at higher risk in some cases, and whether or not community health really works. So just comments from both of you about, do you see that to be the case? I think in the first instance of that there is a slower adoption on the vaccine and boosters among, or within the Hispanic community, and thoughts about where we go as and where you'll go as top Latino healthcare leaders to try to address that issue.
I'll say, coming out of El Paso, we're 80% Hispanic, and I think I alluded to that we had very high vaccination results because of the fact that we were an epicenter. But I don't think you can take away still for other communities, even here in Arizona, that, in our relationship with healthcare as a minority population, and I'm talking all minorities, if we look at our Black, Asian, and Hispanic populations, there's been a great deal of mistrust. We have examples that we could go back in history, and I think that's a reality. And I think, I do think community health still works, because ultimately, whether it's the individual, whether it's at your parish home, as it's your community physician, your sort of that informal leader in your community who is saying it's safe. I think those are still some of the best avenues that we just need to find as healthcare organizations. How do we partner with them to give them the right information?
Yeah, I agree with that. I think it does come down to trust, particularly in the Hispanic community. For us in Tulsa, we're under 20% Hispanic. We have a growing Hispanic community here, but there's not a lot of Hispanic providers or even bilingual providers in this community, and that's I'm sure that's a little different in El Paso, but that's a key part is making sure we find that right connection with that population, to that they trust what we're saying. And quite frankly, one of the benefits of this vaccine was how quickly it was able to kind of be deployed. But I think the speed also created some distrust. I mean, there wasn't enough time to do kind of these outreach initiatives and really kind of maximize the use of some of these community health centers. And so it had to be the information that was distributed pretty quickly. And so I think sometimes that builds some distrust. So I think really finding the right providers that can connect with that population, and also retraining the providers. So for us, that's another aspect that we've missed in the past that we're focused on is there's some distrust from the patient of what they're hearing from the providers, but sometimes the providers have some perceptions of why patients are doing things the way they're doing things, that may be cultural in nature, that we need to retrain the providers on how to recognize that and kind of pause a little bit. And so there's some things we're doing around that. We're doing a teen birth initiatives where we really include the patient on the front end as part of the care team. That's been a huge win. And again, as part of that is just to continue to build that trust with that population. Yeah.
No, those are really great points. And in that, again, going back to that sort of trust with the community and Monica, this, we've talked about this on other panels that you and I have done together. I'm a strong proponent of the idea that this is the part of the argument about the power of diversity in healthcare leadership, right? Is that healthcare leadership needs to be diverse in order to be able to serve the community as a whole. And that means being able to have diverse perspectives and understand the cultural issues that Xavier, you're highlighting too, that can sometimes relate to how that is actually communicated out to all facets of the healthcare community. So I think it's a really great point, and in many ways I would tell you I think it's part of what NALHE is about, is that diversity in healthcare leadership and making sure that the Latino perspective is there and prevalent and part of our leadership's teams. It brings me back a little bit full circle in the conversation, and we actually had a really good question at the start that I held on to because I saw that somebody in the audience posed this question, but I wanted to come back to it because I think it actually is a really important component of this discussion, with the two of you shining examples of fantastic Latino healthcare leaders in our country. And, you know, the question that was posed was, how did you do that? How did you get yourself into that position as a Latino leader to be the healthcare leader of your systems, to as I think the question said, how to break through and do that? I know that is a huge question, you guys, and we could probably go on for another hour just on that. But I think just, you know, for each of you to reflect for a moment and share with the audience your thoughts on that, the importance of it, but then also some you know, thoughts for others that are really wanting to model and follow in your footsteps.
Yeah, I think for me, Tom, I think that's an excellent question. And you're right, we could have a whole other hour session on this. But, you know, early on in my career, I volunteered at a hospital, and the leader there happened to be a Hispanic leader. And so, you know, I was able to kind of connect with him in a way that I all of a sudden kind of saw an opportunity for me as a Hispanic to get into this field of healthcare. I think that was the entry point. And I think that's an important piece, is the entry point, getting people that are interested in understanding that there are opportunities in healthcare, particularly for Latino leaders. And once I got in there, I had a passion for it, and I've never slowed down. And there really wasn't, you know, from entry point to where I'm at now was really, you know, my passion and motivation to continue on. But early on, it was that connection that I saw with another, you know, Hispanic leader that kind of got me hooked. He served as a mentor. And so I think from our role, and I know Monica does this quite a bit, you know, serving as that mentor, really just that, you know, being able to sit down and kind of chat with other individuals that are interested in the healthcare field, and being able to spend a few minutes and talking to those types of individuals and kind of guiding them and mentoring them. And I think we need to continue to do that as a field. And I think that'll help open that up.
Yeah. And my story is not unlike Xavier's. Mine actually happened between my junior and senior year of college, where I was trying to figure out what I was going to do next. And I knew graduate school was on the horizon. And family friend who happened to be the president and CEO of our university, you know, public hospital, invited me to come shadow. Really fell in love with that, you know, the passion piece of it. But I'll say, you know, not always does the individual look like us, or, you know, wasn't a Hispanic female. I have been very blessed to have sponsorship. You know, mentoring is important as well, but also sponsorship for others. Those on the call here who are in leadership, I guess I'll stress and say that the reason I'm sitting here is because I had both male and female, white and otherwise colored leaders above me who saw something, who were willing to sponsor, gave me an opportunity to stretch beyond where I thought I could be stretched. And I think, you know, when we advance, we have an obligation and a duty to pay it forward, and to give back and to continue to bring up the next generation of leaders. So it's interesting. We have the very same exact path, but, you know, mine took a little bit of a different road, and I'm very blessed to be here. And I think often of those early mentors, sponsors who really, I say I'm here because of them.
Yeah, no, that's wonderful. That's wonderful. And I love to hear those stories, you guys. Thank you for sharing them. And I know it's valuable to everybody who was able to attend as well. And I likewise feel blessed to have had the opportunity to get to know both of you and work alongside both of you in the great efforts that NALHE is doing. And from my perspective, that's what I would say to everybody. You know, that's an opportunity for involvement, mentorship, learning, camaraderie. And I think those are all important aspects to that. And thank you to you both for having this conversation today. It's been a real pleasure, and I always know it because to me, I could keep going and going and going. There's probably a bunch of things we could chat about, but we'll save those for maybe another time. For our audience participants, thank you very much for joining us for this great conversation today. This is part of an ongoing series that we will be doing. Husch Blackwell, in partnership with NALHE, is going to continue a series of these conversations about topics of interest and highlighting some of the fantastic Latino healthcare executives that we have in this country. And we look forward to doing that. And as a final point, before we let you all go for the afternoon, I would be remiss if I didn't put in a plug for the NALHE annual summit that will be coming up later this year. As you're all looking for those opportunities to get back and do some stuff live, that's going to be live. We're going to be all together in lovely Milwaukee, Wisconsin. I promise there not to be snow on the ground when and it'll be a really fantastic event, and we're looking forward to it. So again, Monica, Xavier, thank you for spending the time with our audience today, and thank you everyone for joining us today for this discussion. Have a great afternoon. Thank you.